Hi, this is Dr. Philip Miller. I'm a facial plastic surgeon specializing in rhinoplasty here in New York City. And I wanted to go over some rhinoplasty terms that a lot of patients would benefit if they knew exactly what it meant in order to communicate with their physician about what it is that they want to achieve in their nasal or rhinoplasty surgery. The first one is tip terms, the terms we use for the tip of the nose. Actually, let's stop there for a moment and go over something even more basic. The nose is broken into thirds, the top third, the middle third, and the lower third. The top third is typically the bone, and that's really rigid and hard. The middle third is more rigid cartilage. It moves, but it's pretty firm. And the lower third actually is also cartilage, but it moves quite easily. That's called the tip of the nose. The lower third is the tip of the nose. So when we use terms like projection, projection means taking the tip of the nose and bringing it out like Pinocchio or bringing it back like a shrinking Pinocchio nose. So projection refers to the tip of the nose going further out, or deprojection means having it come closer to your face, further away from the face or closer to the face. That's in distinction to rotation. Rotation is whether or not the tip of the nose goes down or if the tip of the nose goes all the way up. So it's rotating like this as opposed to projecting, which means sticking out further or coming back. Another one is nasal length. The length of the nose is from this depression here all the way down to the tip of the nose. So some people have very short noses, some people have very long noses. People who have very short noses often have very rotated noses. Those who have very long noses often have tips that are very, what's called counter-rotated. So it's rotated, counter-rotated. Seems a little silly, but it really gets the point across. Projected and deprojected, and then the nasal length. One other term is nasal height, which is the depression here to the base here. That's nasal height, as again, the difference between nasal height and nasal length. I have some cards here so that I can remember what it is that I wanted to go over. Another important distinction is recognizing the difference between the facial plane and the dorsal plane. Now, if we look at the nose, there's the face right here where the cheek meets the base of the nose, and the bridge of the nose over here, or seen on profile, this part versus this part. This part versus this part. When we talk about the nose being very wide, it can either be wide at the facial plane or it can be wide at the bridge or dorsal plane. So try to be very specific in communicating with your physician exactly where it is that you are unhappy. Is it the base, or is it at the facial plane or the dorsal plane? Finally, I want to make sure that you don't use confusing terms. One that I hear very often is straight, make my nose straight. Well, does that mean that from the front the nose is perceived by you as being a little crooked and you want it straight? Or does that mean from the side view there's a bump and you want it narrow, you want it removed so that it's straight from the side? That's a very common term that can be misleading when you're speaking, or confusing when you're speaking to your surgeon. Another one is higher and lower. Sometimes people use the word, I want to make it lower, and what they really mean is that they want to take the tip and deproject it. They want to take the tip and bring it closer to the face. Or often that they want to make the bump or even the bridge of the nose more of a curve. They mean that by saying lower. And finally, narrower. Often a patient say, I want my nose narrower. Again, where do you want it narrow? At the tip of the nose, at the facial plane, or maybe along the bridge of the nose. I do a fair amount of, sadly, I do a fair amount of revision rhinoplasty cases, those patients who have been operated elsewhere and are unhappy. And I find without question one of the #1 reasons why patients didn't get what they wanted is that there was a miscommunication between the patient and the physician. So using this terminology, I hope that you'll be able to communicate with your surgeon a little bit more precisely what it is that you want to achieve from your rhinoplasty operation.